Welcome to Wills for Life by Dr. Jemimah, and today we are talking about family planning and especially on hormonal contraceptive. So hormonal contraceptive was designed to help mothers or help families plan their desired family size. It is no longer common to have women with more than 10 children as it was in the past. And that is either by design or by choice, but we as medics are here to help you make informed decisions. So there are two methods of family planning. We have the hormonal, we have the non-hormonal, and we actually also have the permanent method, which we call sterilization. But today we'll focus on the hormonal method of contraception. So on hormonal method of contraception, they are designed based on the body's normal hormonal patterns. As a lady, you have your normal estrogen and progesterone that go through peaks and troughs so that you're able to ovulate. The method we'll start with, which is a combined estrogen-progesterone method, is designed to reduce those peaks and troughs to give you a stable dose of the two hormones and therefore prevent ovulation. So how combined estrogen and progesterone works is by blocking ovulation, because you don't get the surge that one gets in order for you to release an egg. There are other ways that it works. For example, it goes to the cervix and increases the mucus content, and it also reduces the lining of the uterus. So that we see more on the progesterone hormones, but it can also work on the combined estrogen-progesterone. So COCP, as we abbreviate them to sound, are also used for hormonal balancing. So for example, you're having irregular bleeding and it's due to a hormonal imbalance. We can use these particular pills to balance your hormones. Or if you are using a long stay progesterone method and now you have excessive bleeding, it's also one of the pills that we use to balance your hormones. So who is able to use COCP? Anyone really above the age of 18 is able to use a combined estrogen and progesterone method. And this is because other than regulating the hormones in the body, it doesn't have many other effects, okay? So we have seen people use them from as young as 15, especially if the periods are very, very painful. So it's one of the ways that we reduce painful periods because of, again, it stops one from ovulating, which we know is one of the causes of painful menses. Generally, people that we avoid having them use the pill is, for example, if you have heart conditions, because estrogen has functionality in the blood vessels. So if you have heart conditions, if you have prior history of breast cancer, especially if you had a breast removed due to breast cancer, and especially cancers that are estrogen dependent or responsive, okay, so that your gyna would explain better. If you have issues of diabetes, again, because it also affects the blood vessels, we would be wary of giving you that. If you have issues of hypertension, we would also be wary of giving you COCPs. If you have issues of headaches or migraines, sometimes the pill can increase your headaches and migraines. Therefore, we will avoid giving them in patients who already have unexplained headaches, okay? If you have prolonged amenorrhea, which means a long period without having your menses, we would first have to check why is that so before we give you the pill as a treatment option, okay? If you are pregnant, of course, we're not giving you the pill. And if you get pregnant while on the pill, perhaps because you missed a day or two, then you kindly stop it and see your gyna for further help. It would not affect the pregnancy at first, but it would reduce the hormonal levels required for the drug to work optimally. If you have liver disease, we would also ask you to avoid using COCPs. Anyone else aside from this is okay. There are patients who may have sickle cell disease but are unable to use the coil or other methods. Sometimes if the benefit outweighs the risk, then we can continue with the method, but it will require closer follow-up with your doctor. Okay, so that's who can and who cannot use the disease. If you're breastfeeding, sorry, should have started with that. If you're breastfeeding, please don't use the pill because it will reduce how much you can get your breast milk. It also reduces your lactational power. So kindly, if you're breastfeeding, especially between the 6-week mark and the 6-month mark, kindly don't use the pill unless you are strictly bottle feeding, strictly feeding on formula such as NAN. Then it is okay to use the pill. Between delivery and the 6-week mark, we also avoid it even if you're not breastfeeding because you have a likelihood to get a clot. So that's who can use and who may not use it. Next, we're going to go in how to use it. So this is one of the pills that one can use. We have not been sponsored, but this is one of the pills that one can use. Most pills will come with a number of every day that I hope you can see this close. So it will have 1, 2, 3, all the way up to 21. So if I turn the pill, you can see it has the yellow pill and the red pill. This red pill is only iron supplements, and it is because at this point we anticipate that you are bleeding. But the yellow pill is what has estrogen and progesterone. So most of them will have about 30 micrograms of estrogen. Am I right? Yes, we'll have about 30 micrograms of estrogen. Most issues that we get with the pill are due to the amount of estrogen in the pill. So for the younger generation, you'll see that we use a pill that has less dose of the estrogen, but that can still work, is still efficacious. Okay, so you take this pill every day, one every day, either in the morning or at night, without forgetting. So if you decide you're going to be taking it at 9 p.m., then every day at 9 p.m. you take the pill. 2, you create the same steady flow of the drug. The problem of forgetting to take the pill is at the time that the drug is not there, your own body hormones will surge up. And if you forget for a day or 2, you can actually conceive. So most people who complain about failure of this pill, you would find that they just didn't take the pill in the correct manner. So assume today is Thursday. Assume today is Thursday and you forgot to take your pill at 9 p.m. You remember on Friday at 7 a.m. What you will do is you will take your Thursday pill in the morning, and then at Friday at 9 p.m. you will take your pill again. So I hope that is clear. If you forget to take a pill, take it when you remember it, and then during your normal pill time, take the normal pill. If you remember on Friday at 9 p.m., which means you forgot yesterday's dose completely, you can take 2 pills and then proceed. It will give you a higher surge of hormones, so you may end up with a bit of nausea in the morning, but it should be okay. If you forget more than 3 pills, just stop, talk to your doctor, have the bleeding as usual, and then start a new pack altogether. Okay. On the pill, another important thing is we start the pill during your periods. Ideally, on the 3rd day of your period is when you start this pill. Okay. And then you'll take it every day for 21 days. Between the 22nd mark, which is the red pill, somewhere along that week, you will bleed. If you bleed on the 5th day or the 6th day, and 28 is the next day, on the 1st day of the next pill, you'll take your pill as usual. I hope that is clear. Let me repeat. Assuming you stopped your pill on day 21, which is what should happen, and then you waited for 5 days without seeing your blood flow. And then your blood flow started on day 27. So you bleed on day 27, day 28. The next pack will start as usual from the first pill. Even if you bleed on the last day of the red pill, you will still take your pill regularly. If the 7 pills end, the 7 red pills end, and you have not bled, please see your doctor, okay, before you start any other pack. Assuming you forget to take your pill and then you take 2 or 3, you take your 2 pill and then another pill. What happens is for that week, you may not be 100% safe because I told you there'd be a surge in the hormonal content. Therefore, it is suggested that you use condoms for that particular week for 5 to 7 days. So to be safer, just use for the entire week. And the good thing is you can tell which week you missed, and therefore you can be able to take your pill accordingly with extra protection. Okay, if you're using the pill and you're HIV positive and you're meeting someone who is not using PEP or is also or is HIV negative, also you'd have to use the protection. Remember, this only prevents pregnancy. It doesn't protect you from STIs. Now, what are the risks of using this? Of course, everyone asks you about adverse effects of using any drug, including paracetamol. So this also has adverse effects, okay? The ones that we say are minor ones are, for example, when you start using the pill, you may end up having headaches, nausea, vomiting for the first 2 to 3 cycles, okay? As your body is getting used to the extra or the synthetic pills. These ones usually pass, okay? Some people will end up with weight gain because of the progesterone within the pill. If you're one of those, you may benefit from having low dose COCs and the weight gain effect will reduce, okay? Another thing is if you are a smoker, please avoid the pill because it will increase your chances of getting vascular disease and cancers, okay? So if you're a smoker, please do not use the pill, okay? The other thing is, as I said, if you're breastfeeding, it will reduce your milk supply. So this particular one is not the pill we give for breastfeeding. Moms, be careful. This is not the pill we use for breastfeeding, okay? Yeah. So what are the benefits of using the pill? One is that it balances out your hormones. It is very protective actually from most cancers like the ovarian cancers. This would protect you from it. Estrogen containing cancers, especially like uterine cancers, this would also be protective. But it is not protective against breast cancer, okay? So be on the lookout as well. So as we said, there are major complications that you can have when using the pill. Very rare, but it is important that we mention them. Number one is high dose contraceptives, COCPs, especially the ones that were created in the beginning, were linked to higher levels of depression. So if you take the pill and you note that your moods are sinking quite a bit, please talk to your doctor so that they can change the type of pill or the type of family planning altogether. For some women, it can either reduce libido if there is increased vaginal dryness, or it can increase libido. So that is really dependent on your body. So if you notice that there's a change in that particular method, please, in that particular area, please also talk to your doctor. High dose contraceptive pills are also associated with hypertension. So if you had issues of hypertension, even in pregnancy, it would be one of the things you would consider not using if you have that kind of issue. But the commonest and highest risk is actually venous embolism, or what we call DVT. So how to know that you have DVT? You would feel pain on the calf. For Kenyans, we call it sgwembe. So you'd feel pain on the calf area, and that pain would be more on one side than the other, and you may have swelling on one leg more than the other. So when we look at women who have DVT and we look at their history, we can pick sometimes that they use of COCP. So if you have history of varicose veins or you have history of DVT in your family, you can also use it for a very short period of time or avoid it altogether. So I hope you've learned a thing or two about your combined estrogen progesterone method. As we move on to the progesterone only methods, please write in the comments if you have any questions we can further clarify on. And if you haven't hit subscribe to the channel as we go on to progesterone method. So now we delve into progesterone-based methods. So progesterone-based methods work on the cervix to thicken the cervix and create a mucus plug that is very thick. Okay, that means that sperm cannot penetrate as usual, and therefore you're not able to conceive. So they don't work so much on the ovulation really, but they work on such the thickness of the cervix is so thick that now the sperm cannot go up. Okay, it also reduces the speed or motility of the fallopian tubes, enabling them to the egg going into the uterus, and then it thins the lining of the uterus so that even if an egg and a sperm meet, the lining is so thick that thin that it cannot be able to attach correctly, and therefore you will not be able to get pregnant. Okay, so that's basically how the progesterone method works. Because it doesn't give you estrogen in your body, you're likely to not have your menses for a prolonged time. There are three main methods of progesterone-based hormones. We have the mini pill. I said mini pill. So it's taken each and every single day, unlike the COCP that you take for 21 days with a 7-day break. This one is continuous from the first day of the cycle until the day you decide you don't want to use this method again. Okay, so that's the mini pill. Then we have the depot. The depot injection is given every 3 months, and you'll be given a return date a day or two before your next injection is required. Then we have the implant or the implanon or Jodel, depending on which one you find in your country, that can either last 3 years or 5 years. Okay. Then the fourth one, which we use mainly for irregular uterine bleeding, is called Mirena. It is a coil that is inserted directly to the uterus. And this particular coil helps in reducing the lining of the uterus, as I said, and therefore you get less and less flow with less and less pain. And of course, because it's working centrally, you have less and less effects than we see when you use the other methods. Okay, so those are the 4 main methods. And all of them work the same way, by the way. Cervical mucus thickening and lining of the uterus is made thinner. For the Mirena, it thins really well, so that's why we use it for things like endometriosis, adenomyosis. We use it for just irregular uterine bleeding. Okay, fibroids that one is not ready to have a myomectomy yet, it's one of the places that we use Mirena. Okay, so now to go into each individually. So we have the daily pill. The daily pill has to be taken each and every day at the same time with a plus or minus of 3 hours. If you set at 9 p.m. and it's 12 midnight, then the efficacy has already started reducing and you have to use extra protection for the next 2 days. Okay, so it is one of the methods that you have to be very, very keen on how you take your drug. Okay, the other thing is that when you're using these particular pills, you have to check on, for example, things like breast tenderness, which may be okay, and it is the only method that is oral that is safe for breastfeeding mothers. So you find when you go to your 6-week visit, we will give you, if you choose a pill, that is the method that you're going to be given. Okay. So that is a daily pill. We recommend it up to 6 months after breastfeeding. Then we ask you to take something longer because of that effect of forgetting. But if you're not forgetful, then well and good. If you're working with the alarm, well and good, you can continue with the method. Okay. We have the depot injection. The depot injection is given every 3 months, as I said prior. It uses a hormone called medroxyprogesterone. I would suggest, and this is a personal opinion, to not use it very often because it has been shown to have a longer duration of time before return to fertility. So if you remove it, you can stay for a long time, sometimes up to 2 years before you conceive again. So it would not be my method of recommendation. Although for some people, they finish using the depot and immediately they conceive, and that is good, okay? Then we have the implant. The implant is placed at the underarm of your less dominant hand. And we have either one rod. If it's one rod, it takes you for 3 years. If it's 2 rods, it takes you for 5 years, okay? Of course, with plus or minus some months. So this particular method, all the 3, you will notice that for some women, you will keep bleeding, but it would be spotting, and then it goes away. So because it's spotting, it may go sometimes longer than a week, okay? For some women, you will find that there's no bleeding at all for the entire time that you're using the method, and that is normal. We said that it blocks the cervical mucus and it thins the uterine lining. So I like to think of it as progesterone is the hormone of pregnancy. So when you're pregnant, you don't have bleeding. So the same hormone can induce the same effect during use when it's used as a contraceptive, okay? Then when it comes to weight gain, it is notorious for changing your weight. Either you lose weight or you gain weight or you remain the same. So again, dependent on how your body responds to the hormones. So some people, you will lose weight. For some people, you will gain weight. For some people, you remain the same. When it comes to acne, it tends not to really affect your body acne-wise because it doesn't have so much estrogen. It has no estrogen. So that is okay. Then when it comes to libido, again, it will act like pregnancy. So for some women, you will have very high libido. For some women, you will have very reduced libido, or it will remain the same. So these are things that you can discuss with your doctor if they're affecting you unnecessarily. Most people who remove the progesterone method would be because of irregular bleeding. As I've explained, it can have irregular bleeding where you have 4 months without menses and then 2 weeks of menses, then 5 months without menses, then 1 month of menses. In which case, kindly see your doctor so that your hormones can be rebalanced. Remember, you're going a long time without your menses, so at some point you'll have what we call a breakthrough bleed, which means that the lining of the uterus just now needs to shed because it has reached the capacity required for it to start shedding. And because there's no estrogen coming up, then it keeps shedding. So when you see your doctor, we're able to reverse that and you can continue using your method without any issue, okay? It is imperative if you're using any method of family planning to kindly still do your cervical cancer screening every year because it is important to just check for your cervical cancer treatment, okay? So I hope this helps someone wherever you are. For the Mirena, I already highlighted where we use it. We use it more as medication rather than hormonal method of contraceptive. But for those who are able to get it, it is a really good method of contraceptive. So I hope this helps someone, and yeah, see you in the next one.